Hi guys, welcome back to another video where I answer somebody's question. So this person wanted to know, what type of fluid do we keep on our aircraft? This might vary from program to program, aircraft to aircraft. We keep pretty basic level of fluids on our aircraft, so I'll show you guys what that is. Starting out with the most basic is normal saline, 0.9% normal saline. Normal saline is what we like to think of as salt water. This is isotonic, so it means that it doesn't cause the cells to shrink or to swell. And the osmolarity of this is 308, which is very close to human blood. So this is just very nice volume resuscitation and compatible with every medication that we give. So this is our go-to hanging fluids. Obviously it is 0.9% sodium chloride, so it does have sodium in it. So we might use this sometimes for different issues with sodium electrolytes. Or we keep it in the 1 liter, and we also keep it in the smaller 250 so that we can use this to make medication drips. And we do carry another kind of saline, and this is used for something very specific. It's 3% sodium chloride, and this is called a hypertonic. So as a hypertonic, this has a higher concentration of solute, which is your salt, to the solvent. And because of that, it draws water inside the intravascular area. So that makes it really good for things like cerebral edema, because in a closed space where we don't want any extra fluid taking up room, we want to pull that back into the vascular system so it can get filtered outside of the cranial vault. This sometimes can help buy us some time to keep somebody from herniating. So not to be mistaken with it like pulling hemorrhaged blood back into the vasculature, but it can help with some of the water that's in edema that comes from a brain injury, pulling that back into the vascular system and helping that get cycled away, and hopefully creating just enough space that the brain itself can swell without it herniating. And then next is like D5 or D10, so that is dextrose water essentially. So in D5W, that would be 50 grams of dextrose dissolved in a liter is that concentration. A lot of people carry it in like a 250 or a 500 bag, and you can also carry it in a liter bag. But here in the aircraft, it's just not as practical for us. Obviously, that's going to be good for keeping someone's sugar up who's hypoglycemic, but if you want to talk about if it's isotonic or not, it is in the bag, but it becomes hypotonic once it's in the body. So once your body metabolizes the dextrose, it leaves behind free water, and that shifts from the bloodstream into the cells. So in someone with a TBI, that might not be the best fluid to infuse. Other than that, we don't carry a ton of other like pure fluids. Most other things are medications that we give, but yeah, that pretty much covers our fluid tour. There are other common fluids like LR, lactated granulars, which have a bunch of electrolytes in them, sodium, calcium, chloride, potassium, and also has lactate in it, and that lactate acts like a buffer and the liver converts it to bicarb. That's isotonic too, very similar to the pH of your blood. And then there is Plasma-Lyte, which I found was really common in the ER that I worked in to give to trauma patients. It really does imitate the pH of the blood well. It's another mixture of a bunch of electrolytes. It just uses a different buffer than LR. It's just a very balanced crystalloid formula that you might see used as well.